Welcome to the Class Video Spotlight Series. I'm Sean Howell, Director of Customer Insights, and I'm joined today by Aaron Gleave, a Research Director in Core Ambulatory Solutions. Thanks for joining me today, Aaron.
My pleasure, Sean.
So Aaron, as you know, we're here today to talk about Dr. First, but can you help me understand, just as we get started, how does Dr. First fit into healthcare technology in the healthcare industry?
Sure. Dr. First is an intriguing company. They very much work behind the scenes to make critical things happen for healthcare. And a couple of the areas that we looked at in this report were medication history and secure communications. And those two pieces are oftentimes very much behind the scenes, and KLAS doesn't necessarily measure medication history specifically. And so this is a very valuable first look at what they do and how they facilitate a very important piece of healthcare delivery.
That's great to know. Now, I know for this first look report, we looked at the medication management suite as well as backline. Can you tell us what medication management suite is?
Sure. So for this part, we're talking about getting access to a patient's medication history. And so the two key pieces are access and accuracy. So for a clinician, from a clinician's perspective, they have to be able to get access to that medication history, and then they have to be able to feel confident that it's accurate. And so Dr. First, that medical management suite, delivers that, and they do that through partnering with vendors like SureScripts to make sure that they have that information, to make sure that it's delivered into the electronic health record so it's accessible to clinicians and that it's accurate.
And we talked to a bunch of their customers. What are some of the things we heard from customers about how they're doing with this medication management suite?
A lot of the respondents that we spoke with were very pleased with the experience. They felt like it checked the boxes of what they wanted it to do. They were getting access, they felt confident that it was accurate. In fact, some of them even mentioned that it was hard for them to know everything that was going on because it worked so smoothly behind the scenes. So that was a validating success for the vendor in terms of that functionality. They also mentioned being able to see outcomes very quickly. So within a couple weeks most of the time, but a minimum within a few months, they were seeing the outcomes and it was doing what it was supposed to do. So a quick time to delivery there.
And what about any opportunities for improvement that KLAS uncovered as we spoke to their customers?
A few of the respondents mentioned some frustration with EHR integration. So, and they did concede that some of that responsibility may have been on the EHR vendors to provide some better integration options. But just to make sure that that flow of information from the medical history into the electronic health record was happening, it was happening completely and accurately. There were a few little hang-ups there that they thought that the vendors could work on and work out a little bit there.
That's good to know. And as we wrap up talking about this medication management suite, what are the key takeaways, the main takeaways before we move on to backline?
Ultimately, Dr. First has a customer base that spans most of the different types of healthcare facilities, whether you're a hospital, community hospital, standalone, independent ambulatory clinic. It's an option that is working, that is functioning, and that is delivering these very important medication history views for clinicians. And so it works across a broad spectrum, and it works well.
So Aaron, as a provider is considering a purchase in this space, particularly with medication management suite, what are some of the things they should consider?
Well, Sean, aside from obviously what facility type they are and kind of what they're looking to accomplish with medication history and their electronic health record, there's a couple other key pieces of the suite that are important and that might be very appealing to providers. One is the Rxm Form, which is a module that Dr. First provides for clinicians to help track and monitor a patient's medical routine, right? So it notifies them if prescriptions are being refilled, if they're staying on top of those, if they need to be refilled, or just kind of help a patient manage their own medications. And so that's a piece that stands out too, and that the respondents certainly noted was a valuable piece of the overall experience.
Okay, Aaron, let's shift our attention now to talk about Dr. First Backline. Can you start by telling us what Dr. First Backline is?
Sure. So Backline is Dr. First's secure communications platform that provides HIPAA-compliant channels for for communication between clinicians at facilities and between clinicians and patients, right? So that covers text messaging, emails, all that type of communication that needs to be protected for HIPAA reasons.
And as we spoke to customers, what are some of the things that we heard? What is Dr. First doing well with Backline?
Backline for the messaging, for that secure communication piece, is extremely solid. So we saw data from the customers that emphasized it was very solid, seamless EMR integration with whatever medical record they were using, and that the vendor was very proactive about releasing enhancements that facilitated and moved that product forward. So very strong on that secure messaging piece. Backline also includes telehealth functionality, which is obviously a newer feature within the last couple of years. And the telehealth functionality, according to customers, has a little bit of work to be done there.
And so, can you tell us about some of the opportunities that KLAS uncovered in this first look report with Backline?
Sure. So mostly it was relative to the telehealth piece. It seemed like the respondents were noting that they could have had better integrations with their electronic medical records. Also a more seamless experience, and that the help desk could maybe provide a slightly better, more user-friendly experience to help customers walk through those difficulties as they're trying to set up and install and manage those telehealth experiences. So a little bit of work to be done there.
And then as a provider is looking at the space, considering their options, what are some things that they should keep in mind or consider?
So for Backline, obviously with secure messaging, it's a fairly broad market. There's a number of different players that customers could consider for that type of a solution. But Dr. First is an up-and-coming player in this space. There's no question about it. We saw some very positive data that indicates that they are really making a move in this space to provide a very strong, seamless product that delivers across a wide variety of facility types, whether it's acute or ambulatory settings, that they are making themselves a very viable solution and option for providers. So in terms of things to consider, they would again want to look at their core electronic medical record and understand what the limitations may be, if any, integrating with something like Dr. First. And so that would be a conversation to have and explore with the vendor if they're taking a serious look at Dr. First. And that was the same for the medical management suite, right? We looked at that, and that's something that you just have to take a look at especially if you're on an enterprise level solution, Epic, Cerner, Meditech, wherever you're coming from. There are some nuances there. There are some differences that we pull out in the report that you can see in the report where there are some differences that need to be considered.
This is great information. Now, looking at Backline as a whole, what would be the key takeaways for someone who was looking at Dr. First Backline?
So, if you're a provider looking and considering a solution like this, a couple things to consider. First, we validated that providers typically see outcomes very quickly, whether it's the Backline or the medical management suite. Usually within the first couple months, almost 100% within the first 6 months. So outcomes are fast. It's a solution that gets up running quickly and efficiently, pretty quick. And it checks the boxes. So for Backline, it does what it needs to do for the HIPAA compliance, for making it safe, secure, and seamless. So it does some really good things there.
Well, Aaron, thank you so much for taking the time to talk to us today.
Sure. Yeah, it's great to be here, Sean.
As many of you know, KLAS's mission is to benefit healthcare providers through providing accurate and honest and impartial information. If any of you know of innovative or emerging solutions that KLAS should be aware of that we can do some research on, please send an email to etech@klasresearch.com. If you're interested in this report about Dr. First, you can find this report as well as others at klasresearch.com.